All right. Madam Producer, are we good to go? We are good to go.
Welcome, everyone.
Welcome, Dr. Simons and Michelle Kennedy. You notice, you do know us if you've watched this before. This is our Monday Ask Me Anything Facebook Live. We are open today. Welcome. Thank you for tuning in. And we got a good list of questions today. I'm wearing my Hurricanes gear. We got the Carolina Hurricanes. Our NHL franchise here in Raleigh is in the playoffs, and tonight they're playing the Nashville Predators. So just showing a little fan support there for the Hurricanes. I didn't grow up watching hockey, so it's kind of a new thing for me. But I know many patients that come to see me grew up in more northerly places, and they did grow up watching hockey, and they love the stuff. So I have to admit that the game atmosphere is fun. So we're giving away another $25 gift card, Target gift card today.
Yes, the trend continues.
Yeah. So what do people have to do to enter their name in to get the gift card?
All right, so we need you to do two things. We need you to like this video and then also comment #SimonsAMA. So like it.
Video.
Hashtag
SimonsAMA.
Yes. And there's also share the video. Of course, it's not part of it, but we really like to get folks who maybe haven't seen us before, who have only caught one from long ago, to kind of get back into it. There's a lot of good information. Thanks to you guys for sending in your questions. These are questions that you ask us to address. So we know you guys are thinking about these topics, and we're happy to help kind of navigate you through it. All right.
Yes.
Denise is already on it.
Yeah, Denise. Awesome.
Nice.
Good job. Getting a little fan support from the Dr. Simons patient base. All right. So
we're going to start with Chelsea from Raleigh.
This is a great question that Chelsea asked.
Is there any truth to adding more zinc to your diet to help with weight loss?
Chelsea, this is a great question. So I don't think Michelle, you'll probably agree with me. There's probably not any study that I'm even aware of that looked at whether zinc causes you to lose weight.
Yeah.
If there is any quality study that's out there about that, I've not seen it. But I am a big fan of zinc. And this is a good time to be taking zinc.
Yes.
Okay. You would not know this. I'm always saying this sort of thing to my patients when they come in. The only source of information is not just what you see in a brief news clip on one of the major news sites about health-related items. They'll give their little 1 minute and 30-second spiel or whatever, but there's a lot more to it than that. So zinc is turning out to be a home run during the pandemic.
Yeah.
So the way that these coronaviruses work is they do their stuff inside your cells. And the one thing that stops them from replicating themselves inside of your cells is zinc. Zinc is a home run. Now, zinc comes in several forms. And so probably the most common form is the zinc picolinate. And I tell people take at least 50 milligrams a day of that. But zinc is a charged ion, and it does not get from out of your bloodstream across the cell membrane and inside the cell easily. That cell membrane is made of fats. And so charged things can't get in there correctly. And so you need a transporter. Okay, a transporter. Now, I don't say what I'm about to say to be political. But I want you, because I know this has come up in the context of politics. I'm bringing it up in the context of medicine. I mean, during the first 4 or 5 days that you're infected with the coronavirus, that it's replicating itself inside of your cells. Okay. And it turns out that oral hydroxychloroquine, which is in use for other reasons around the world and has been for a long time, and at low doses is very, very safe, is a great transporter of zinc. Does no good to take that after the 5th day. Okay. You're in a different phase of the disease at that point. It's not about replication. You want to stop the replication. First couple of days, zinc with something like oral hydroxychloroquine is a home run, but that's a controversial subject. It shouldn't be, but it is. So you can get an over-the-counter supplement that does this, and then you don't have to fight the political fight, you see. So it is called, now, some people call it quercetin.
I say quercetin.
Okay. And then I have a friend who says quercetin. Okay. So I can pronounce quercetin. Quercetin, 250 to 500 milligrams a day, available. You might have to wait to get it because so many people are buying it because of what I'm saying. But if you take that per day with 50 milligrams of zinc, you will be doing yourself a very, very big favor in terms of if you were to contract this virus, okay, it really limits its ability to replicate. And so there are some evidence-based protocols put out by big university systems that are based on this concept and that have their employees taking this as a way to prevent this disease from either infecting you or really doing the nasty deed once it has infected you. So think of it that way. Now, zinc is so critical to a lot of other things in your body. It wouldn't surprise me if you were taking zinc and the quercetin and it also helps you lose weight. I just can't cite a study that shows this.
Right, and there's a lot of examples of that, honestly. So I think, Chelsea, the important thing is zinc a very important part of a healthy life? Yes. Can we say for sure it's going to help you lose weight to eat more foods that have zinc in them? No, but those are also generally very healthy foods that have zinc naturally occurring in them. So it would be a good idea to include it. I don't see why not. Why not? So thank you for joining us at our Monday morning Simon's AMA Live. We are asking that you do two things in order to be eligible for a gift card.
$25 Target gift card we're giving away, and you got to do two things to get your name in the pot to get it.
Like this video and hashtag Simon's AMA in the comment. We have Denise, Candace,
Allison, Charlie, and Adrian.
Thank you, everyone. Feel free also to send us a comment or a question through the live feed today.
Denise says, "Let's go, Canes." That's right.
She's on it. She's on it. All right. So we're going to move on to Marie from Cary. She's asking, do you recommend liposuction or surgery for a patient after substantial weight loss? We actually touched on this on our last AMA. So I'm glad you brought it back up, Marie. We have patients in our practice that have gone through procedures. We are now in our practice offering an option, but I think the important thing that we touched on last time before we talked more about it was 6 months following the beginning of your maintenance journey. So when you reach the weight that it's been decided we're going to try to maintain that weight for, 6 months from then, a lot can still continue to change with the body, including some changes to skin and how things fit and just how you feel in general.
Yes, I agree with that. A lot of times you can't imagine it. So you lose the weight, you stick with a plan of diet and exercise and give it a little bit of time to see where your body kind of settles out, because it may look a lot better than you're imagining. So there's the thing about liposuction you need to know kind of conceptually, liposuction and surgery. Liposuction removes subcutaneous fat. And a lot of patients who've lost weight, the issue is not subcutaneous fat. The issue is excess skin. If you lost 150 pounds, for example, in many cases, the problem you're worried about, the excess, is excess skin. There's not a lot of subcutaneous fat. So doing liposuction doesn't fix that problem. You probably need some surgical body contouring that removes some of the skin and then tightens it up. And these are very common procedures for plastic surgeons to do.
And we've had patients who have had them.
That's right. I would want to make sure, another reason to wait at least the 6 months is you got to be sure you can keep this weight off. Once you take that skin off, and gain 150 pounds back, you got a problem. So you want to prove to yourself, hey, I'm good at keeping this off too, right? And then we have a non-surgical option that we're offering now, some machines that do this non-surgically, but it's really designed for skin tightening and for subcutaneous fat reduction in patients who've lost some weight or really are dissatisfied for a number of reasons with loose skin and so forth, or in various parts of their body. And we've rented an office space next to our Durham office, and we have some of these very nice machines in there. And you can call for some more information about that. We've got a nurse specialist who handles all that sort of thing. and the procedures are painless. It's very, very effective, but she would need to look at you to determine whether you're even a candidate. And that doesn't cost any money. Okay. You would need to understand, okay, here's what I can expect out of this, and here's the limitations. Because it may be a situation if you have a lot of skin where you just need surgery, and we're not going to try to sell you something that, it's not going to work for your problem.
Right. And there's no judgment for folks who do decide to go the surgical route following their weight loss. I know some people can struggle with the idea of doing a cosmetic surgery, but quite frankly, if you have worked so hard to get your health and your body to a place where you want it to be, and there's just some things that aren't going to be able to be altered without some help from a cosmetic surgeon, go for it. If you're able to do it financially, absolutely go for it. We have a lot of patients who have done it, and they are so pleased that they did, and we are so happy for them. So I think Marie, we got some options out there, and you're welcome to call and talk to us more about it. But thank you.
We got a question in the comments section from Denise.
Yes.
Denise, you want to know about can you become tolerant, essentially resistant or tolerant to the phentermine? And what other options do you have? And is there anything that works as good as the phentermine? So I'll just say that there's not a lot of medicines out there to help you lose weight. Unfortunately, there's a lot for everything else. But in this one area, for reasons I've just never been able to figure out, there's not a lot on the market. Okay. So, and some people want to know, what is phentermine? Phentermine is the most commonly prescribed appetite suppressant in the United States today. We call those anti-obesity medications. It's true that the mechanism of phentermine is to suppress your appetite. It does have a side effect of being somewhat of a stimulant for people. And they often grow tolerant to the stimulant effect, just like they do to coffee, for example. Okay, but then when they stop taking it, they find they're a lot more hungry. So they're not nearly as tolerant to you got to separate out, am I tolerant to the stimulant effect or to the appetite suppressant effect? Because if I stop it and I'm a lot more hungry, it's doing something. Okay. So that's the first issue you got to sort out. The other thing I'd say is, and you may have done this already, but we do some off-label prescribing here. See, when phentermine was approved by the FDA in 1959, about 2 out of every 100 people in this country was overweight or obese, and today it's 75 out of every 100. So it wasn't taken very seriously back then, and no weight-based recommendations were made on the initial FDA label or any of that. All the other stimulants that have come along since are weight-based. And so sometimes what I'll do is even though it's, it's not something that's on the FDA label, Michelle or I might, in your particular case, evaluate where you're at, look at things like your heart rate, your blood pressure, that sort of thing, and decide to up the dose. Okay, so you can get the effect you're looking for. There are other things that could be added to it. They work by different mechanisms. There's a few things that we can prescribe them here pretty regular. Topiramate, metformin are very good examples. There are there's 2 newer prescription things that are on the market that may be helpful to some people. One of them is very, very expensive, and the name of that product is Saxenda, and most insurances do not cover it. So it has a limited use. And then there's Contrave, which works on an addiction mechanism. If you're addicted to certain things, it blocks addiction receptors. And that generally runs people $100 a month. Some insurances do cover that. The weight loss is not as effective head-to-head as with phentermine. So when you give up the phentermine, you, in most cases, deal with a decrease in efficacy with other substitutes. So we have another question in the comments section. It's about patients with post-gastric bypass. Yes, we see patients like this all the time. They're struggling with hunger. Every week I see these patients. And so I would say that just because you've had a surgical procedure doesn't mean you're not a candidate for medical things. I happen to think that the medicine really, really helps in this sort of patient. So we'd love to have you come in. We've seen lots of patients like you. And look, it's just, even if you're just a month out, I've seen them a month out, I've seen them 10 years out, 5 years out. There is a road to regain in these folks. And sometimes, adding on the medicine helps. I've had patients who lost a certain amount. And look, with all the bariatric procedures, not just the standard gastric bypass, but the sleeve gastrectomy, the duodenal switch, the lap band. I've kind of seen all of those things, and I found that medicine helps all those people because they can end up gaining weight back, and in many cases they go on and lose down to their lowest point, and then additional more when we add medicine.
Yeah, surgery is a wonderful tool. It's a very powerful tool, but it is just a tool. It is unfortunately not a cure because obesity is a chronic, progressive, very complex medical condition. And so the surgery for some people can be all they need, but for many folks, at some point after their surgery, they will need additional help. And that is okay. We have a lot of patients in our practice who have had surgery anywhere from a month ago to 10 years ago, and they're looking for assistance, which we absolutely can provide. And so we're skilled in knowing, based on what you've been through and what you're experiencing, what would be appropriate as far as a treatment plan, and we can individualize that to you.
Yeah.
So give us a call. Then thank you for that question. We really appreciate that, Allison. We look forward to hopefully talking to you.
That's right.
All right.
Got Corey in Durham. Kind of a question that we've had a lot over the years.
This is a good one. What's the difference between Atkins and keto? And I think I've said this before. My analogy is the way we call every tissue a Kleenex. It's easy to call everything keto the Atkins diet. It's just kind of a brand of a ketogenic diet. So Atkins is not necessarily different. Atkins is just a brand that has really capitalized on providing Atkins brand products that are keto friendly, right? Bars and shakes and snacks and trail mixes and frozen meals, and the list goes on and on and on. So you can do Atkins and you are definitely keto, but you can do keto and not necessarily be doing Atkins because you're not having any of their products. Yeah. So hopefully that makes sense.
Yeah. Interestingly enough, Robert Atkins, he never, when he was alive, I like to correct the notion that he died from some sort of metabolic disease. He hit his head on the ice. He slipped and fell on the ice and hit his head and bled into his head. That's what killed him at 81 or 82 years old. But he, when he was alive, they didn't have all these products. Okay, he didn't believe in all of that, and he really wasn't a big fan of net carbs and all that so much. He really liked gross carbohydrate counts. So there's been 3 books that I'm aware of that bear his name. The very first was in the early 1970s, and that was the oldie but goldie, in my opinion. I mean, everyone who went to see this guy in his clinic, and I know that a nurse that worked in his clinic for him, and another doctor that very close to him, everyone that went to see him was metabolically very sick. They weren't just overweight. They had bad diabetes and heart disease and so on and so forth, lipid problems. They were inflamed in every sort of way. And just to give you an idea of how serious this guy was, he was teaching ketogenic diets before ketogenic diet was popular. They weren't calling it the Atkins diet then, okay? But he let you have 4 things during that first month. That was it. You only had 4 things you could do. And he's rock solid about this. Meat, eggs, cheese, and butter. That's it. You could eat as many times a day as you want, as much as you want, but that's all you could eat. And I'm telling you, he corrected everybody's problem in a month in terms of the metabolic stuff. Their blood sugars would normalize, their lipids would get way better, their inflammatory markers would go way down, and they'd lose a ton of weight. Okay, and then he'd begin to very sparingly add in things like vegetables. Okay, but that's way different than buying products and using net carbs and all that.
Yeah, he was very simple, but very powerful.
That's
very
right.
Effective.
Very effective tool. And so Bob Atkins was keto before keto was cool. He was in the high fat, not just low carbs, essentially no carbs was the way he would really start you out. And he was aggressive about it and did a lot of great things, I think, for the medical community in this regard. Okay, so in the comments section, we haven't been in the office in several months. This is from Candace. Can we just make a regular appointment to come back? There's no additional charge, Candace. Yes, you can.
Yeah, no additional
Once a
steps.
patient, always a patient.
That's our motto. So just
We're
give
not
us a
going to
call.
pay a restart fee or something. Just a regular office fee for follow-ups. That's all. In fact, so some of you, I see these patients like this every day. They've had packages. They bought a package a year ago.
Right.
And they didn't use all the visits on it.
Mm-hmm. I had someone
they don't even realize it.
It was for like 5 years that she had a prepaid package because we have an opportunity for our patients for the follow-up visits to get a discount for buying 3 follow-up visits or appointment costs up front. And that's for accountability, right? It saves you money, but it also leaves you with the idea of, well, I've already paid for that visit, I should probably go, right? And that's really important, right? It's important to have that regular touch point with your provider. So it's always fun when it's been 5 years and we say, your visit's already been paid for.
Yeah.
all you have to pay for is medication or product or whatever. Oh, hi, Queenie. Thank you for joining us. So much. Queenie is a fantastic patient in a Raleigh location, and she has done an amazing job. I love your picture. Look at that blue lip. That is hot. Yeah. So thank you for joining, and thank you for that question, Candace. It looks like Denise has a question too. How long would you recommend protein shake meal replacements? She says she drinks 2 protein shakes a day that have 23 grams of protein. We are big fans of protein shake meal replacements for individuals who like the idea and can find a product that they like. We don't make you do it if you really don't like the idea of shakes. I know some people say anything milky or I can't drink a meal. And that's okay. But the research is so clear and has been from the beginning that meal replacement shakes are a direct beeline to getting you to your weight goal.
Absolutely.
They really do work. And there's some great ones available on the market.
Correct. Yeah.
Affordable, tasty.
It keeps you from doing a lot of stupid stuff, I always say.
Yeah.
I mean, you do those and you can't screw it up, right?
Yeah. And as far as timeline, everything is pretty individualized. So some people, maybe that's an avenue to get them to a place and then they want to try to incorporate some different meal ideas or options. But quite honestly, these protein shakes probably have more vitamins and minerals and protein than a lot of the standard meals that you might otherwise choose.
So Denise, you can do them forever.
Yeah, there's not really a limit.
From a health standpoint,
they're working for you, and they keep you in on your plan and in a structured, routines that you're not having to make decisions that, maybe, weren't the ones that you look back and say, that was a good one. The shakes can be really, really good. Just takes care of it. Simple, easy, healthy. So thank you. The devil, Denise. The devil that is menopause seems to have stalled my weight loss. You are not alone, Denise. We can assure you of that. The hormonal changes that happen in the perimenopausal and menopausal period are profound, and they impact weight for most every woman. So let us help you. Or if you don't have an appointment set up an appointment. We've talked about metformin before, which can be a home run medication to add when we're really trying to target the insulin changes, or insulin's that fat storage hormone that we produce when our blood sugar goes up, and it has a vital role. But if you produce too much of it, which many of us females do in perimenopause and menopause, it's going to put us into more of a fat storage mode, especially through that middle area of the body instead of a fat burning mode. So metformin can be one tool that can help protect you against that effect.
That's correct. That's absolutely right.
These questions are great. Thank you, everyone. And if you haven't already, liked the video and done hashtag Simon's AMA to enter our gift card drawing at today's show, please go ahead and do so now.
Okay, Selena from Durham, do you believe that someone's weight is hereditary? Yes, there is a genetic component.
Yes, there is genetic.
Yes, that's right. So there is a genetic component. It's one part of this very complex disease. We live in an obesogenic environment, and this makes it worse. So if you have DNA that says, hey, boom, gain weight, let's hold on to it, and then you put it in the American environment where everything, 90% of the food makes you more overweight. Whoa, problem, right?
Yeah, absolutely.
So it's another reason to take this serious, manage it medically, right?
Yeah.
To try to prevent weight regain. I'll just say, I'll just put it, the patients who know me know this. I don't like the BMI. This is one of the reasons I don't like the BMI, okay? Because it's about keeping you from getting all of these diseases associated with obesity, right? It's or caused by obesity, things like diabetes. And I just think of animals. Okay, think of dogs. I've got a Yorkie, but other people have a Great Dane, like Courtney, who works here, has a Great Dane and so forth. They're both dogs are different sizes, and people can be different sizes, right? So this is okay. The question is, hey, are you metabolically sick because of your weight? And we don't want you to be that way. Okay, but don't get fixated on some ideal type weight.
Right, I agree.
Yeah.
I agree. And to the point of genetics, just because you have a family history of weight does not guarantee that you will be struggling.
Yes.
It does not guarantee that you won't find success if you are struggling and then seek treatment. And then on the flip side too, if you struggle with your weight and you don't see anyone in your family that does, that also does not mean that there is something uniquely wrong. Because in this environment, all you need is like a little bit of a genetic predisposition. And like Dr. Simon said, it will come out, especially in America, unfortunately, with our food supply. So thank you for that question. Our last question that got sent in is from Stanley. What's your experience with alcohol addiction, I believe, or drug addiction that have turned to an unhealthy habit with food? So common. I believe in AA, there's encouragement if you are having a craving for a substance that you're trying to avoid, that sugar is actually a good alternative. And it makes sense. It works in the brain in the same way to kind of numb or pacify or reward. And there is a strong neuroendocrine component with these brain chemicals. So it happens all the time. We have a good number of patients in our practice, I would say, that have a history of addiction to other substances that have turned to food. And I know Dr. Simon's mentioned Contrave, a medication that really works primarily on the reward center of the brain. And sometimes we will see that be helpful, but we have other medications too, and just kind of supportive plans that can help. Therapy can also be really helpful, like cognitive behavioral therapy in this regard. So we have experience, we have some recommendations, Stanley. So please reach out and let us help. So thank you for all those questions. I think it's time to announce our winner for our gift card. So thank you for everyone who has sent.
Is that FEARS?
Sent everything in.
Okay.
The winner is, drum roll, Allison Fears.
Allison Fears, you're the winner of the $5 gift card. It's awesome.
Yay.
Yeah. So congratulations, Allison. We'll message you to get your gift card out to you. Stanley, I'll just circle back as the last item.
Go ahead.
Look, these addiction centers in our brain, food can trigger them. Okay, so often when people come off of one substance, they'll use food to trigger the same center in their brain to create the same sensation they had to the substance that they were addicted to. So you have to guard against this stuff. And there are medicines designed to help with this. Okay, so it's probably worth trying if you're having an issue here. Topiramate is one of them, and which, look, it's generic, it's cheap, and we use a ton of it here in the office. It's been around a long time, it's safe. And then I mentioned earlier, one of the newer obesity medications is a combination of two of these kind of medications designed for addiction. It's called Contrave. Contrave is a mixture of Wellbutrin, which is used in smoking cessation, and naltrexone, which is used in opioid recovery programs. It blocks those receptors, and you can trigger those receptors with food, and it creates a pleasure sensation. It's very powerful. And so just, you might know a recovering opioid addict, they actually will eat sugary things because it triggers the same receptor in their brain that the opioid was being used for. And so this sort of thing blocks those receptors, so you can't get the pleasure response from it. So this is something that the provider could talk with you about, and we could definitely work to try to help you.
Absolutely. And I want to touch real quick, closing up, but yes, Queenie, we do prescribe metformin in the practice a lot. We have great experience with it and great results. And Denise, I get it. The nurse in you is worried about low blood sugar. Luckily, metformin does not come with the same hypoglycemia or low blood sugar risk that a lot of the other medications that treat diabetes do. So we have really never had to worry about that in patients. But thank you for bringing that up, because I think a lot of people do worry about that.
Okay.
Right. Thank you so much for watching our Dr. Simon's Facebook Live AMA. There'll be show notes. This will be recorded. You can find this one as well as all the other ones. We're open in both offices.
Correct.
Yeah.
So until 2 weeks from now,
we'll
thanks for your participation, and go Hurricane.